Hi everyone, and welcome back to Excellence Noir, where we seek to raise the standard and change the status quo. My name is Tasha Lord, and on this channel I share my experience as a registered nurse living in the UK. So I moved from St. Lucia in 2019, and since then I have worked in England. Now today I wanted to share with you the different specialties that are available within the UK. So many people have reached out to me and saying that they want to come, they're not sure which unit they want to work on or what specialty. And as you guys know, I have worked in ICU here. Now I have always worked in ICU since I qualified, so I feel like I don't know how I would function in the other units and the other specialties, but I wanted to just add a little fun to the video. So as I speak about the different specialties that are available, I will try to imagine how I would function in those specialties. So if you haven't subscribed, go ahead and subscribe to join my family. And if you are one of my normal subscribers, then welcome back, guys. So let's go into A&E, or what some people might call emergency nursing. So A&E, or accident and emergency. So as you come to the hospital, these are the first set of nurses you will meet. Now I feel like if you're somebody who loves like that fast pace, you love that kind of chaos. I feel like A&E is organized chaos, not that the place is so chaotic that you don't know what's going on. I feel like the staff in A&E know what's going on. Other people don't know what's going on. Because I remember once back home, I was floated to A&E because our ICU, I don't know if we didn't have patients or there was only one patient. So they sent me to A&E. And I remember I got there and I was thinking, because in ICU, so used to things being a certain way. And I get there and I'm thinking, what? And the thing is, the nurses are there and they're doing their stuff. They know what they're doing, but I was not. I remember I had patients, like they gave me the patients who needed just like nebulizers. And I think it was like 4 of them. And then I wasn't sure like which nebula I'd given, or which person, like if I had given the second one or if I had given the. And then I remember after a while I just went in the toilet and I was hiding. Anyways, that's in my past. I'm not that person anymore. But A&E is for anybody who loves being on the go. And these days A&Es are crazy. Emergency rooms are crazy. There's so many people. The wait time is so long. It is madness. I don't even know how these nurses. I always take my hat off to A&E nurses because I'm very impressed by them. But guys, if you were working in A&E back home, or it has always been your passion, this is one of the areas that you can explore. There's so much to learn there, and I feel like it helps you to develop as an individual, because it is. A&E is baptism by fire. Yeah, that's all I can say. So another specialty, as we get to the little ones, is NICU. So you have your nursery, back home we call it the nursery, and here you have your neonatal ICU. So that's where you have the very preemie little babies who can be ventilated or they need extra support, just like critical care patients. And if you have always had a passion for that, or if it's an area you want to explore, maybe work in an adult ICU and you are interested in moving and learning something different, I would recommend the NICU. I love everything to do with ICU, but I could not imagine myself working in like with these little babies. I've always felt a way about babies, like even the like full-term babies. I remember when I was a student and we had to go and we had to feed them like with the little cups when they were just born, and you have to feed them with these little cups, and I was thinking, oh, they're choking, oh my goodness, you know. No, I know it's not for me. I don't know, is it something I would ever explore one day? Maybe, but I feel like as much as I would want to learn and see the difference between neonatal ICU and adult ICU, I feel like I don't know how I will deal with people losing their babies. Like that probably might affect me psychologically. And so I think, because in my ICU back home, it wasn't really like, we took children, I think from 1 year. So we didn't have like a children's ICU. We took like from, I think, a year, we took those children. So we did have small children dying with us, like toddlers dying with us. So I remember that was very traumatic for me. So I feel like neonatal ICU, even pediatrics, it's not for me. Now, pediatrics is another specialty I wanted to speak about. If you love children, if you have the patience with children, if you are very fun. I feel like with children, you need to have a fun personality, especially as a nurse, because I mean, they're in hospital, they might be afraid, so you want to make them feel comfortable and relaxed. So if you like that, that is another option for you. So don't feel like in nursing you're limited, you just have to come and do adult medical wards, 8 patients, 10 patients, and you just give medications and these things. There's so many other options. So pediatrics is another one. For me, pediatrics is a no. I remember watching a doctor, all of these experiences were when I was a student, because like I said, since I qualified, I've worked in ICU. So the doctor was trying to put a cannula, and then the baby, I don't know how old the child was, but the child just got up and started like screaming and fighting, and then she already had the cannula in the needle, and then when the baby got up, the needle pricked her as well, and she was, oh my goodness. And I remember I was like, no. But I think it's some people, I did enjoy my rotation in pediatrics, because I enjoyed like being very playful with the children, and like after a while you start to feel like, you know, you connected. Like those who were there for a long time, like you cannot wait to come because you want to see them, or you want to find out how they're doing and that type of thing. So pediatrics was nice. It's not my thing, but it's for some people. Another option that you have is mental health nursing. Now, the hospital that I work at, we have a mental health unit right behind the main hospital. And so sometimes when we have our patients, the mental health nurses, they stay with some of the patients that are sectioned or are from the hospital, so they stay with them, and so we get to interact with them. If you're somebody who's always had a passion for mental health, or your background is mental health nursing, as you do your application, you can also apply for mental health nursing here. Or even if you're here already and you want to try something different, you can look into mental health nursing if that's your thing. If you find there's something that is very intriguing about it. I remember my rotation as a student in mental health. Although initially, when we worked in the very acute units where the patients were really, like, they just came in and they're really bad, they were having all these episodes, I was very fearful. I can remember that. I was very fearful. But when we worked with the long stay patients who had been there for a while and they were on the medications, it was really nice, because I remember we had one of my colleagues, he used to play the guitar. So he would bring his guitar in, and then we would play for them. We would sing songs and everything. It was really nice, and they enjoyed it. They would sing for us as well. So my rotation was really nice in mental health. I don't think I would ever work in mental health, because you guys know where my passion is, yeah. But it's something that you can explore, and a lot of the mental health nurses that I meet here, they do say that it's very risky, yes, but they enjoy it. So I mean, if it's your thing, then you can try it out. And the reason I'm sharing these specialties with you, because not everybody knows. Sometimes, like our hospital, we're very limited. We just had the basic ICU, this, that, and the medical and surgical units. So we have more specialties here. Based on where you come from, you probably have those same specialties, but I'm just sharing for people who might not know. So we also have oncology. So if you are somebody who is interested in working with cancer patients, helping them with their care and sorting out all of their stuff, and the whole process that they go through, being able to support them in that way, oncology nursing is maybe something that you can look into. And the reason I'm sharing these specialties with you, because not everybody knows. Sometimes, like our hospital, we're very limited. We just had the basic ICU, this, that, and the medical and surgical units. So we have more specialties here. Based on where you come from, you probably have those same specialties, but I'm just sharing for people who might not know. So we also have oncology. So if you are somebody who is interested in working with cancer patients, helping them with their care and sorting out all of their stuff, and the whole process that they go through, being able to support them in that way, oncology nursing is maybe something that you can look into. So in our hospital, we have a cardiothoracic center, and in that center, it's like a little hospital on its own. There's the cardiac ITU and the different wards, but all of these are cardiac wards. And what you would be expected to do if you work in one of these cardiac units, you would work with patients who need cardiovascular care. You'd probably assist with cardiac surgeries and know the different procedures and how to care for patients, the nursing interventions necessary to help patients to recover, to prepare them for the surgery. So all of these things. So if you feel like you love cardiac, and even me, I remember a few months ago they were asking for general ITU nurses. I work in a general ITU. They were looking for nurses who were interested in going over to the cardiothoracic center and to work in a cardiac ITU. And I mean, it's a good thing because, you know, apart from general ITU, there's neurology ITU, cardiac. There's so many different ITUs. Excuse me. There's so many different ITUs. I was thinking maybe I could go into and look into, because it's something new, and I mean, I'm gonna learn so many new things. But like you guys know, the love that I have for where I work, I don't know if I will get that there. So I was a bit iffy about it. But anyways, when the time is right, God will lead me. But you can look into cardiac nursing if that's something you're interested in as well. And they're always looking for staff. So if you're somebody that was your background or that's your interest, you can apply. You can look for the vacancies and apply for these jobs. There is also gerontology. So as a geriatric nurse, you would work with elderly patients, senior citizens, older people, to help them to get their care. And within the whole geriatric nursing, you would have specialties like dementia, being able to work with patients who have dementia and other conditions. So if you feel like you've always been passionate about that, and for me personally, even when I have my ICU patients who are a bit older, like, I feel like they are usually the best patients. Like, they're usually the calmest. They're usually the most grateful. You can have conversations with them about everything. They really, like, my heart goes out to them, because I mean, I am young. Well, I'm not very young, but I'm not old. And I feel like, well, this life is something else, you know? And imagine being like 70 years old. These people have gone through a lot. And I love to speak to them and learn from them and listen to some of them are so wise. And yeah, so if you are interested in geriatric nursing, that is something else you can explore. Another specialty is occupational health nursing. Now, this one is new to me. Since I came here, I didn't know that there was any occupational health nursing. I didn't know anything about that. But basically, these nurses are responsible for supporting staff. So, you know, if you're at work, you'd be sick, maybe you would have certain issues and it affects your work. So these people help you to be able to get a balance to like if your schedules and these things are affecting your work, or you have any health issues, anything that's related to work, like you have an injury. So all of these safety things, anything to do with your health and work, these occupational health nurses would be responsible for that. Your vaccines and all of these things, they would be responsible for that. So these people work in offices, yes, and it's not really bedside care. So they work with nursing staff and the hospital staff. So if you are interested in that, you're not really interested in bedside nursing, that is something that you can look into. So you also have your orthopedic nursing. So if you like all of these fractures and metal plates or all of these whatever orthopedic surgeries, if you are interested in these things, if you've always been a surgical nurse, orthopedics is something you can look into. If you there's a few surgical wards, there's also medical wards. So if you're somebody, you just love your medicine no matter what, you love all of these, what's happened to the camera? You love this. I don't know, I feel like I haven't met anybody who loves medicine, like being on medical wards. But if you feel like that's your thing, you love it, yes, go for it. There's medical wards, there's theaters, so you have your recovery nurses, you have your scrub nurses, you have there's ODPs who help with the anesthesis and to help to prepare the theater for surgery and all of that. So you can decide to be an ODP, but there's trainings that go along with all of these roles, just to let you guys know. But the trainings are not things that you wouldn't be able to get, guys. One thing I always tell you guys about hair is that there's a lot of opportunity. So if you feel like that's something you're interested in, you can always go and find out about the training and do it. So there's ODPs theater nurses, scrub nurses. These are things you guys can look into. Now, I don't know how I would work in a theater. Maybe in recovery, yes. I don't know. I always thought if I left ICU, I would work in theaters because I just like that kind of stuff. But I could work in the recovery, but I don't know if I'll be able to work in the theater itself as a scrub nurse or circulating nurse, so I don't know what they call them up here. And as an ODP, I love to work with anesthesis, but I feel like it's ICU anesthesis. And I don't know how well I would get along with surgeons in theater, because sometimes the way surgeons behave, well, I'm not generalizing like all surgeons, but certain attitudes that you would see, you feel like, if I have to really be in the theater with you, like, yeah, so I don't know. So that's one of the things that always made me feel like because for me personally, I am somebody, I do not like people to undermine me or to ill-treat me, like especially if I haven't done anything but you just trying to, like, you feel like you're better than me, or you feel like you're higher than me for whatever reason, maybe because you're a doctor and I'm a nurse, or you feel like you can speak to me anyhow. The type of person I am, I do not tolerate it at all. So I think for peace sake, I would just avoid the theater. There are also school nurses. So if you love working with children and you love working with children and you love nursing, then you can work in the schools with the children. There are also district nurses, so you can go in the community and work with people and bring healthcare to people at their homes or in the communities. There are a lot of options, guys. There are midwives, and back home we had to complete our nursing degree and then do an additional do another course to become a midwife, but here people can just do midwifery. So if you are interested in doing midwifery, or if you are a midwife back home, then you can do your process as well to come across to be a midwife. There are so many different specialties, and I feel like you can move if you're somebody you want to increase your knowledge and you want to improve your skills. You can move around in the different, the different areas, the different specialties, and to be able to improve as an individual, to be the best at, your job. If you are interested in, let's say, just surgical units, so you can work on all the different units and see, and then maybe you can apply for a higher post to be able to manage surgical wards. So all of these things are options that you have. But like I said, guys, if you are interested in something, never feel like, oh, maybe they might not take me, I will not send the application because I'm not good enough. Try. At least try. Do your research, prepare yourself for your interview, do what you have to do, show up and answer the questions, impress the people, and you never know, you might get the job. So even if you've never worked in the unit, but you are interested, let them know why you're so passionate about it, or why you are interested in working that unit, and show them that you are willing to put in the work that it takes to be good at whatever you're doing. So don't go for all of that stress. Get the job, and when you get there, the people wonder, why did they hire this girl? You get there and you do your best. You work at it, you learn things, you spend time reading, you spend time watching videos, things you don't understand, you ask questions, and you make the best out of it. I know that nursing is, I feel like it's, and I was watching some videos about what's happening in the US with nurses, and a lot of people leaving the career altogether. And I'm wondering sometimes whether it's the generation, like our generation is just different. People coming up now, they no longer tolerate things. There's like they only tolerate like that. And so people are like more empowered to stand up for what they don't believe in, and to stand up for what is wrong. So I don't know, but there are still some things about nursing that we can enjoy, some things that we can still control. And as much as I will keep saying it every day in my life, the salary for nurses in the UK is not enough, but there are still a lot of good things about working as a nurse in the UK. So anyways, I hope that you guys enjoyed the video. I tried to put in a little humor every now and then, but there are so many different specialties in the UK for nurses, for you to grow as an individual, to improve your skills, and to be able to give the best care to your patients. So I hope you guys did enjoy the video. If you did, give me a thumbs up and let me know in the comments what specialty you work in. Have a blessed week.